You've held a discharge slip in your hand, but you've never seen what happens on both sides of that hospital door. It's 9 p.m. when Meera brings her father into the hospital. Chest pain, difficulty breathing. Within minutes, he's on an emergency bed, wires everywhere, doctors moving fast around him. An hour later, he's stable enough to be shifted to a regular ward. Meera breathes for what feels like the first time all night. She has no idea that in another room, a coordinator is already watching his numbers, quietly preparing an ICU bed just in case. The doctor asks her father questions. He answers slowly, scared. Meera wants to scream, "Just help him!" But she says nothing because she doesn't want to seem difficult. This is the first thing nobody tells you. Families go quiet exactly when they most need to speak up. By midnight, his condition is stable but not safe. A nurse checks on him every 20 minutes, not because a chart told her to, but because something about his breathing worries her. She never mentions this to Meera. She just keeps coming back. At 2 a.m., his oxygen drops suddenly. The room fills with people in seconds. He's moved quickly to the ICU. Meera follows but stops at a door she isn't allowed past. Inside, it's controlled. Practiced hands doing exactly what they've trained years for. Outside, in the waiting area, it's the worst moment of her life. Nobody tells her which version is true. Both are. He stabilizes. A doctor comes out tired and says 4 words. He's okay. We're managing. Meera doesn't know that same doctor has been on his feet for 11 hours straight and still slowed down to say those words gently because he knew she needed them. The next few days are quieter but harder in a different way. Waiting, visiting hours, small updates. Then finally the numbers look right. He's moved back to a regular ward and Meera can stay by his side again. A nurse brings tea, no sugar, without being asked. Nobody assigned her that. She just noticed and she cared enough to remember. On the day the doctor finally says, "You can take him home tomorrow." That evening, Meera sits with the nurse for 2 minutes and just says thank you. The nurse, who has done this 100 times, still tears up a little. The discharge slip gets printed the next morning. Medicines, dates, instructions. So here's what you can do differently, starting with your next hospital visit. Speak up. Write your questions down before the doctor arrives so fear doesn't make you forget them. Ask for one person you can go to for updates. And before you walk out those doors, say thank you out loud. The Gita speaks of action without attachment to the outcome. A nurse who checks twice without being asked and a doctor who slows down after 11 hours are living that truth quietly, every single day. If this changed how you see a hospital visit, subscribe. We open a door most people never see. Tell us in the comments, what's one thing you wish a hospital had told you? And share this with someone who might need it before their next hospital visit.